the Center on Network Science at the University of Colorado, Denver, and an associate professor in the School of Public Affairs. Thank you for joining today. This is our monthly webinar series call. This is, we do this monthly webinar on network leadership lessons from the field. Today, I am really pleased to have a number of our partner users on the phone with us and working today to present cross-sector community network evaluation stories of success using the partner tool. So just a little bit of background on this. As some of you might know, last month's webinar, we went ahead and did a series just on the partner tool, what it is, how to use it, and so forth. And we had a record number of attendees and a Q&A session that went far beyond the end of our session. And so we decided that because of multiple requests following the webinar that we would kind of try to finish that out a little bit and let people ask other questions. So today is a very unique webinar. So not only do we have folks who are going to talk about their use of the partner tool, which is not something that we always do. Our network leadership webinar series has a lot of different topics that we talk about. But at the end of this hour, we have the pleasure of having our entire partner team with us today so that we can open it up for Q&A. We've never done this before, so all of those questions that people might have specifically about using partner, their own projects and things like that, our team is kind of all sitting around the table today. We'll introduce them when we get to that point. And we can answer questions live in the chat box. I'll be leading the actual Q&A through that session. So it's kind of just something we're trying. If it doesn't work out and people don't want to use it, we're not going to. But we get so many inquiries all the time that we thought this might be an interesting way to kind of do some shared learning and some shared answering of questions. So that's how this is going to work today. So full hour of the webinar and then an extra 30 minutes just for questions. So if you're inclined to participate in that, that sounds great. And if not, it's no problem. So, so just to get started, I'm going to do just a little bit of background on our center, the Center on Network Science. Most folks might know, but we do a few things here. We build interactive, accessible tools. Today, you'll hear about the partner tool. I'll introduce in just a moment our person-centered network app. We mostly do work on designing and conducting systems evaluation. You'll see here 3 examples of about 35 that we probably have completed. We are the evaluators of the Kids Count Grantee Network for the Annie Casey Foundation. We also do a project that's currently going on with the evaluation of the regional health connectors in Colorado, which involves 21 partner surveys around the state. And we've done a lot in early childhood systems building. This is just examples from early childhood. We do these kinds of evaluations across multiple sectors for all kinds of folks. And our team that does this work is pretty skilled in this work. We also specialize in measurement and research. And so we do research projects that are just focused on building the field in terms of measurement, algorithms, building those kinds of things, testing hypotheses. And finally, we build collaborative capacity. So that's part of what we're doing here today. We do this webinar series. One of the primary reasons we do it is because we have so many community partners who have asked us for opportunities to present their work. We think our community partners are amazing. And so we just want to have opportunities for them to be able to share what they're doing and how we're all learning together around network leadership. So some of our primary principles are basing this work in a community-based participatory research approach. So it's really important to us that we work very closely with communities in all parts of our work, and that we're constantly focused on translating data to practice. And that's really what makes our center different from most other kinds of folks who do research and work on networks, is that our primary first focus is on translating the data to practice. And we feel like we've put years and years into this and are some of the kind of best in the country that are working on that in that area. I mentioned a few of our tools. We're going to talk a lot about the partner tool, so I won't say much here. We also will be launching this spring our person-centered network app. For those who are network people, it's a way to collect egocentric data. It's a mobile device where you can actually draw your network connections using your finger, just like that picture shows. So we have researchers who are actually using it to collect data on personal networks. But it's also being designed as a way for providers to screen clients and link them to community resources. So stay tuned, because in a few weeks we'll be announcing our call for pilot sites for this, and we're going to have an application process, and it's going to be a really quick 6 to 8 week pilot project, and then we hope to be officially launching the app sometime a little bit end of spring, closer to beginning of summer. And as far as future network leadership training and webinars, next month's webinar, we have the pleasure of Joy Acosta joining us from the RAND Corporation, who will talk about emergent network leadership, how community and public health partnerships contribute to disaster recovery and resilience. And then we don't have our title yet, but we're also very pleased to have Penny Scott from the Community Hubs Ontario and from the Community Hubs division, who has agreed to speak on March 14th, and one of Blythe's colleagues in Canada is we're going to have another person speaking on that day. And of course, hopefully everyone knows now that we have opened registration for our 6th annual Network Leadership Training Academy. So this is our, the thing that our team gets really excited about. From May 16th to 18th, about 80 people will come from all over the country to spend 3 days just geeking out about network leadership, learning from each other, hearing some of the really newest and exciting things that are happening. It's all based on building, managing, and evaluating effective networks. And just a heads up, we usually sell out about 6 weeks, sometimes a month before the event. So if you're interested in this, please be sure to register early. There's a discount for registering by March 16th. And we just are excited to have folks just like you join us. It's going to be a really fun year, we're pretty sure. Okay, here are some ways to get in touch with us. And in terms of the logistics for this webinar, if you have questions related to the topic and for our speakers, please post them in the Q&A box. We'll facilitate a Q&A session at the end. If you have technical questions, like your speakers aren't working or you need to figure out how to do a full screen, put those in the chat box. And we are recording this webinar, and the slides for it will be available after the webinar. Melinda will send out the email with resources and the slides to everyone who registered. All right, so normally we get started right away, but because of our topic today, we did want to spend just a couple of minutes talking about the partner tool and what it is, to give folks who don't know anything about it a little bit of background before we hear from our practitioners. So a little bit of background on the partner tool. It stands for the Program to Analyze, Record, and Track Networks to Enhance Relationships. You can find information about it at partnertool.net. It's really a network analysis tool that we developed with the purpose of building the capacity of practitioners in the community to use a tool like Partner and to use a method like network analysis. So like SurveyMonkey or another Qualtrics, it has a survey that you can customize. There's 18 questions that people use and customize. We truly believe after 10 years of using this tool that these are the best 18 questions to evaluate community networks. But there's also room to add your own questions at the end of any survey. You send the survey out to your members of the network, and when you get it back, you can upload it into our analysis tool. It gives you all kinds of opportunities for analysis. If you like, we generate reports for people and things like that. And it also just has a really clean network data set, so you can put that into all kinds of other programs if you prefer Gephi or UCINet or any others. It's a super clean data set. You don't have to go through that kind of pain of doing that work that you might use when you use other kinds of tools. So it's meant to be used to make it as easy as possible. And of course, we built it with practitioners in mind, but evaluators and researchers have found it, and they're part of our community of users as well. Just a couple of stats on Partner. It was funded by the Robert Wood Johnson Foundation for 7 years. It's used by practitioners, evaluators, researchers. It's been used in over 2,000 communities, all 50 states, and we have users in 40 countries. By a user, I mean a community network. So, and those range. Most of our audience is in public health, probably because we were funded by the foundation for so long, but there's nothing public health-ish or about the tool. If you want to measure networks, you can use it. And these are a little old, but right now we have a database that includes about 12,000 networks, 45,000 organizations, and over 100,000 dyadic partnerships. What does it do? So it maps connections using network analysis, which is a method that collects data on who's connected to whom and how those connections vary and change. It's used to visualize partnerships, track and how and why they're engaging, measure perceptions of value and trust among partners, identify resources leverage, and identify gaps and opportunities. And these are literally things the partner survey helps you do. There's lots of other things as well. Just to throw this up there, there's all kinds of questions that you can answer using this approach. I'm not going to read through these. You'll get the slides after, but you know, these are really narrow in a way, but the kinds of things like what kinds of resources are organizations leveraging, what sectors are already working together. So we just kind of wanted to give you some ideas of questions folks answer. You're going to see some project examples. I'm bringing up, I was contacted by a number of people who said they were going to be on this call and asked if they could see a few of these things. So you're going to hear from our actual users who basically are using Partner to do work in their communities. We just wanted to highlight a few things that Partner that we've been working on doing that doesn't necessarily pop out from using the Partner tool, but you are able to do. So our team has been working on things like this, which is using the partner data and incorporating it into ArcGIS, building these storyboards so that on the right side you see a network map that, you know, is what we're used to. The actual geographic map there you see is the same network, but you can start to kind of delineate it by the different types of relationships. This particular project we were hired for is to look at a national network, and the question was on assessing the return on investment of the network. Here's another one we just wanted to kind of pop up. You'll see a lot of examples like this today, but not all network analysis has maps associated with it. There's a ton of math and numbers behind it. So we blend that with qualitative research. You'll just see a couple of examples here. This data did all come out of straight from the partner tool. We're working on developing state profiles of cross-sector networks using the partner database. One of our team members, Stephanie Bultema, who's in the room with us today, did this work before coming to join our team, and we were just so impressed. This is a profile of Eastern Washington Public Health Network, and you can just see it's super interesting across a number of dimensions. So we're working on that to hopefully in the next year or so build out what we are affectionately calling Partner 2.0 right now, which will be a platform that's different from what Partner is now, but it'll allow people to come in and search through existing network data that is all the way down to hopefully the neighborhood level. It'll allow people to come in and update their profiles, update their partnerships. So it could almost replace the Partner tool and provide a place where in every single state, people can basically build network data in real time and continuously update it. So it'll hopefully allow people to search existing data, look at it at different levels. So an example way of using it is someone might want to search by social determinant of health function and see who's working with organizations in that area, find gaps and strategize, or invite people to update their data in there. So basically it's our response from the partner team to an interest in looking at systems rather than just networks. And so we're going to try to leverage what we have and build a new kind of searchable tool that's going to be available across the nation, but at a very nuanced level. So this is the future of what our work is here. And here's my slide I like to use a lot. It's my long rickety bridge over a dangerous river slide. And it's just to really demonstrate that what's really difficult and challenging in all of this work is not just collecting the data, which is hard, but translating it to practice. And we believe that the bridge is there. We believe that everyone on this call is probably on board that we need more evidence to inform our network leadership practice. And even though the bridge is formed, it's actually quite difficult, and sometimes the planks are there and sometimes they're not. So this is, and we believe our center has actually made a ton of progress on helping to build this bridge. But today, you are going to hear from two people who are actually, we just find amazing at the work on bridging that work from the data and bridging and getting it right out into practice. So you're going to hear today from Blythe Butler, whose title is Network Weaver of the First 2000 Days Network, which is based in Canada, and it is an innovative collective impact initiative that seeks to improve both process and systems and early childhood development outcomes. I'm going to let them do their own explaining of their work. And Dr. Jennifer Marshall is an assistant professor at the University of South Florida and the lead evaluator for Florida's MIECHV program and the Early Childhood Comprehensive Systems Impact Project. And we just think these two evaluators and program managers are just doing amazing stuff, and we have been pretty I think, taken with how much we've learned from them, so ask them if they would come and present today. So I've taken up way too much time. I'm going to go ahead and pass it over now. I think we're going to go ahead and actually start with Blythe. And Blythe, when you're ready, if you want to go ahead and take the screen.
Great.
There you are.
Hi, I'm here.
You're welcome, Blythe.
Thank you. Thanks, everybody. Thanks, Danielle, and welcome to everyone on the call. Am I okay for sound, Danielle?
We hear you.
Okay, great. Yeah, so we wanted to share our experience using the partner tool, and in the description, Danielle mentioned we're attempting to figure out what this thing called collective impact means, and part of our role with that was figuring out sort of the links between network analysis and the collective impact model. So I'm not going to go into any detail about sort of the collective impact piece, but you'll get a sense of what we're striving to do through this these slides. So we approached Danielle and her team about 3 years ago initially to figure out whether social network analysis and the partner tool would help us essentially design our strategy, because we were in early days and we wanted to have some information to work with to help us design our initiative. So that's the frame that we're coming from. We are definitely practitioners, so we come from a very community-based, getting your hands dirty perspective. And this is my favorite slide about community collaboration and kind of what it takes. It says, I think you need to be more explicit in step 2, and in the middle it says a miracle occurs. And I think social network analysis actually sheds some light on what that miracle is and how you can make it happen. So for us, this slide not only illustrates the complexity, but that you can actually work at figuring that piece out. So the work that I do with the First 2000 Days Network is leading the development of the network. And so we are essentially we don't have any programs for in the early childhood development space, and we are not a funder. And that leaves lots of people to ask, well, then what are you and what do you do? And our function essentially is to act as glue within the sector. We catalyze linking, aligning, and leveraging efforts in the early childhood development system, existing efforts, and we enable collaborative action that otherwise wouldn't occur based on that linking, aligning, and leveraging of existing efforts. And our sense was, if we did that well, we would actually have an impact on early childhood outcomes. And so it's not only our purpose or our function, but also our theory of change and the hypothesis we're trying to test. This gives you a sense of our community and how we're developed. We have, of course, systemic level groups involved, organizational level players. We have people who have direct contact with children, and of course, more importantly, the children themselves. And so we really wanted to play a role maximizing all the linkages and relationships within those levels, and try and come out on the other end with something useful for the system. This is our structure. This is how we articulate how we're built. We use a network image, and we use a lot of collective impact language to help describe the connections between the people who are at the core of the network and how their links out into network nodes, out in the community, feed back into the core of the network. So this is a picture of sort of what we're trying to develop very deliberately, and each of those nodes obviously has a different personality, a different timeline, different capacity, different subject matter. So trying to make sense of how all those things fit and flow in and out of the network is part of my role. Again, our theory of change, which will link closely to the social network analysis piece, is that if we're able to build on the momentum in the ECD space in Calgary through sharing, aligning, and leveraging what's working, we will have better outcomes at the system, agency, and community level, which will ultimately mean better outcomes for children. So in there's a lot of things to unpack, but one of them is making sure that we have outcomes at the system, agency, and community level. And then our question was, well, how are we going to know? These are our guiding principles. They fit into more of a conversation on network leadership and what that actually requires to build this. But if you are creating a network, you are essentially creating contagion of the behaviors you want to see in others. At least that's my approach. And so if we want to be a score highly on trust, if we want to have high quality collaboration, these are the kinds of things that we've focused on to make sure we're building amongst the people who are involved, and so that they can help build that outward. This is from a great article called Catalyzing Networks for Social Change, which was one of our foundational documents when we got started by the Monitor Institute. And they just sort of explain very clearly the difference between working with a network mindset and working with a more conventional organizational or hierarchical mindset. And we found this to be really useful. So collective impact and networks, what's the link? The way that we see the link is essentially that the collective impact framework sort of gives us 5 main categories to execute. And then the network approach is about, well, how does that actually happen? So to just give a simple explanation, we see the collective impact model even around the shared measurement piece and how do you know what you want to measure as a community. The collective impact model gives us the what, the things we need to make sure we're doing as an entity. And the network approach really informs the how. What is the quality that we're embedding in that process that helps us build our network? This is a slide from Danielle and her team on the set of values that are required to build good network leadership. And so lots of these things are embedded in the partner tool and how we've approached the partner tool. So what kind of relationships are there? Who feels included? What kind of skills are they bringing to the table? What can the data tell us? We also, this is my version of it, that network leadership is a lot like bomb disposal, horse whispering, and I've added in a little bit of Jedi mastering. So it's not just knowing where the landmines are and how to diffuse them, but it's also bringing people to the table, knowing where they're starting, and using that as the baseline for progress, and then always building capacity in others to do the same. So that's sort of our approach. This was one of our key principles: assess early, often, and on multiple fronts. So we use the partner tool and social network analysis to both measure some internal network functioning and our external network effectiveness. And that helps us tell a story to funders, to people who want to be engaged, and to the people who are doing the actual work of leading and running the network. And then we also have built on top of that on either side an internal tool around collective impact and then an external tool on collective impact in terms of shared measurement. So I just wanted to share this slide to say, you know, social network analysis isn't the only tool. There will be others, and there should be others that help tell the story too. This is my favorite, absolute favorite slide from from Danielle and the team around making the link between community or systems level outcomes and the actual people we're trying to serve, or the change we're trying to see. And those systems level outcomes that are listed in the middle, that's really what the partner tool can help you articulate. Perceptions of value from everyone around the table, perceptions of trust, how authentic is the process, how coordinated, how efficient, how redundant. And so that piece in the middle, that allowed us to tell a huge story about the quality of our network and strategically where we needed to put effort. All right, so here's what we measured, just to give you an example. We measured, this was from 2 years ago now, almost 2.5. So we measured their involvement, and as Danielle said, the 18 questions that are in the partner tool, these are all standardized questions, and these are the responses that we got. So who was occasionally involved, who was deeply involved, where did they come from, how did they tag themselves in terms of sector, how successful have we been at achieving our goal as acting as a catalyst. A fair amount was the feedback we got. Progress towards our goals. So we actually came up, this big long list, it's probably a little bit tricky to see on your computer, but this is lists of, or articulations of our own goals that we wanted to see what percentage of the people involved actually feel like we're making progress towards these. And these are the ones that came up the highest. So that told us something about how we were seen by the people who were involved. And that was important because actually some of the goals that we thought we were making good progress towards, the community didn't feel we were. So that gave us some good strategic information. And people felt at the time that the most important progress we could make was around convening organizations and agencies around a shared goal. And obviously that's ongoing work. We're still every day trying to achieve that. How are people connected to the network? Some have minimal connection in terms of deepness. They're only aware. And 13% were considered themselves closely integrated. So that also told us something about how to be strategic about our engagement strategies, about how we're reaching out to people, and also ask ourselves the question, do we want to increase the number that are integrated deeply at the core, or is this sufficient? Is this actually okay? This is a great graph that basically told us those people who were closely engaged also reported more outcomes. So that tells us something about the importance of engagement and looping people in. Value and trust are key components of network strength, and so we did measure those. These tell us essentially how people perceive others' power and influence, level involvement, and resource contribution, and whether they felt they were contributing to the network in valuable ways. And these are the trust measures we scored on. So how reliable are we to one another, and how reliable is the network itself? To what degree does the network actually support the mission it's stated and supports the mission of those involved? And how open and transparent are we to discussion? What's our culture like around being authentic and open? So these were key results for us. We also added on the research from Darren Hicks, who's a colleague of Danielle's at the university, around process quality. So we asked questions around the authenticity of the process in terms of how the network was being developed. And we also asked questions around how the collaborative, what the results were in terms of working together, what's called the working together scale. So we did a proxy and embedded those questions into our partner survey, which gave us a good idea of how people perceived us working with one another, and what the quality of the overall process was, because that actually leads to increased commitment and increased engagement, which is something we wanted to work on. So these were really interesting pieces of information for us. One of my biggest learnings personally was that collaboration does not equate consensus. There's a reason why there are different words in the dictionary. I think a lot of people entered into the collective feeling like we all needed equal decision-making power. We all needed to be on the same page exactly about everything. Otherwise, how were we collaborating if we weren't all in agreement? And what we've learned is actually the value in not having consensus and still being highly collaborative. Because with a graph that looks like this, in terms of the structure of the network, consensus became a little bit of a fantasy. So we had to find other ways around that. So the value of the partner tool has been incredibly strategic in terms of providing inputs for us to improve our engagement strategy, how we lead, the strategy itself, what we're about, how to develop quality relationships in the context of the network, how we communicate, how we're able to articulate systems outcomes to our funders and to others who are interested, and really how to build a culture that enables a strong network. So because we believe in this, that change happens at the speed of trust, the partner tool actually gave us all the data we needed to go out and see how to build that trust and enable the network to do what it was supposed to do. And I think I'll leave you with one more quote. You think because you understand one, you must also understand two, because one and one make two, but you must also understand and. And I think that is the core of what networks are about. What's the and what's the quality of that and how can we improve it? So I think that's it for me. There's a couple case studies on our website and lots of key documents under our links and resources section, including some articles. So if you're interested and want to learn more, you can go there, and I'll stop sharing now.
Oh, Blythe, thank you so much. We are always super thrilled to hear what you're up to and your work. I think I've learned something every time that we've heard from you. We want to do a quick poll that we meant to do earlier, right before we have Dr. Marshall speak. So for just a second, we wanted to kind of take a sense of who is on this call. So I'm going to go ahead and, do you need to share your screen? So here we go. We're just going to do a poll real quick. The first one is, what is your current or previous role in the network? We just kind of want to let everyone know who is who. So go ahead and do that really quick. Okay, so we want to do just a couple of questions. Well, we're still getting a lot of responses. So this is great. We have about 96 people on the call today. When this little thing stops going, okay, we're getting pretty close. So Melinda's going to show the poll right now. So most folks on the call are a network evaluator, about half the people who answered. And then we also have some network managers and members, a couple of funders, and some backbone organizations. So I love this. We have a few people who have not been involved in a network, and we just love that you're here with us, and then some others. Okay, let's do one more poll real quick. So we're curious who's used the partner tool, and we just want you to answer real quick. Have you used the partner tool before? I meant to do this before we even got started to just kind of get a sense of that. So it's kind of fun watching this tick up like that. Some real-time feedback is really fun. Okay, so we have about, most people have not used it but are interested, so that's great. We're glad that you're here also learning about this. And look at, we have 12 people who have been a manager before, so we're guessing almost any of you could probably present for us today. And then a group who haven't used it. I'm sure these are not mutually exclusive, so I'm sure there's folks who are overlapping these groups. And our very, very last question is about challenges. And so we were curious what people on the call are facing in terms of their biggest challenges in evaluating networks. So if you have it in you, one more poll real quick. So options are figuring out what data we need, access to data, concern that collecting data will overburden our members, the capacity of the members to understand and use the data they collect, uncertainty of how to translate data, finding an evaluation framework. So I don't know if you can pick more than one. I'm not doing the poll myself. So yeah, you might just be able to pick one. So okay, good. We don't have as much consensus on any one answer here, which resonates with us a lot as evaluators of networks. It looks like there is concern that collecting data will overburden network members, and we hear you so much so, but we are kind of impressed that you are here still willing to do it. So thanks for doing this. This helps kind of us understand who's on the call. I want to switch over now to Jennifer Marshall, who I've introduced a little bit, but Jennifer, hopefully you can give us some extra context, and we're just really looking forward to hearing you. So when you're ready, just go ahead and grab the screen and you can get started. And just as a reminder, if you have questions, just queue them up in the Q&A, and as soon as Jennifer's done, we'll do a little bit of Q&A for the presenters. So take it away, Jennifer. So you might be muted, Jennifer. I just want to make sure. We're not hearing you yet.
Okay, I'm on the phone.
Oh, Jennifer, are you still there? So,
Hear me now?
There, yeah.
Okay, I think my phone was muted. Okay. All right, let's see. Can you see me and hear me now?
Yep, we can hear you and see you.
Okay, great. All right, so I'm going to go through 3 examples, actually. I really wanted to share the versatility of this tool, how we've used it over the past 5 years, actually, in Florida. So it's been really useful for us. I wanted to share 3 examples to kind of show you how it can be used for evaluating a statewide initiative that's implemented in a number of sites across the state, how it's used for place-based neighborhood initiatives, that's our ECCS evaluation, and then also how it's been used to track one work group over time, over years. So, so we'll share the slides after. There's a lot of information here, but you'll get a feel for how we've been able to use Partner in Florida. I'm going to spend the most amount of time talking about the maternal, infant, early childhood home visiting, the MIECHV initiative, because that's our biggest project and we're in our 5th year. And the MIECHV home visiting program is implemented in 22 counties, right now through 17 programs. And so this initiative is designed to support families who are living in communities and in conditions and communities and situations that put them at higher risk for poor maternal child health outcomes. And these communities are very diverse. There's a lot of variation. So not only are they in major metropolitan areas like Miami and Tampa and Jacksonville, but also in very rural communities. The variation is also within these sites is that they implement one of 3 different curriculums. So these could be home visitors who are nurses working with families prenatally. It could be parent educators focused on early childhood development, or it could be case managers, social workers there to support families. And then to add to the complexity of the evaluation is these programs are implemented by different types of agencies. It could be a community action agency, a local coalition, or even one is a hospital system. And so you can imagine that these networks vary. It's about 1,600 women, pregnant women and families with young children each year. It's important to understand the networks within the networks before we launch into how we use partners. So this is a federally funded program that's implemented in 50 states, 5 territories, and tribal communities. So, so MIECHV has a federal team and support, and we're part of that Southeast region. And the green row you can see there is our state team. that supports the statewide initiatives. So training and technical assistance, quality improvement, the data manager, and our evaluation team we're independent, but we work closely with the state team. And then, of course, each of those sites in each community consists of the administrators and supervisors and home visitors within those organizations, but also their partners. And then, of course, children are nested within families, within their social networks, and within their communities. We use MIECHV really to focus on the organizational level and most recently at the state level. So these home visitors are really trying to address a lot of areas that are important for maternal child health by visiting each family twice a month. And they support the family's health and well-being through providing social support and education, but also referrals and connections to other programs. So it really does, as you can imagine, take a village to address all of these different areas and to support families. So we use a lot of different methods to evaluate many different components of the program. And in addition to qualitative and quantitative methods and spatial analysis, we also use the social network analysis to understand all of those partners within those communities and how they work together to support these families. We definitely use mixed methods, and we use various theories for these components to consider what we measure and why and how that all fits together. So now I'll get to partner. We have used partner for 10 up to most recently 14 communities over the past several years. And as I mentioned, the communities really vary. We really want to understand the role of the state MIECHV initiative in contributing to systems development state level, statewide, and also how each community MIECHV program participates within their network of partners. As you can see from the chart on the left, it just looks at level of collaboration. From one community, there were 144 interactions. So the respondents within a very large network talked about their relationships with one another. And then the chart to the right, you can see that there were 11 interactions, a very small network in a very small rural community. And so what I wanted to point out there is what we've learned is that the sites in the large metropolitan areas, no one's necessarily better off. They have higher numbers of partners. They also have higher need and sometimes more competition for resources. And then the rural sites have fewer partners they can rely on, so lower capacity, but higher levels sometimes of collaboration. They work together. There at the top, you can see what I call the super map, where we downloaded the partner data from all of the sites and put it together so that we could see all the sites and their clusters of communities within the overall Florida MIECHV. So you can see each white dot represents one site. So as I mentioned, we've implemented the partner survey for the MIECHV program. This is our several times at the site level, and at the state level, we just sent it out for the first time in 2017 because we were really curious about these 35 state agency partners who support the statewide initiative. And so what the tool allows us to do and share with them is what their network looks like, who's part of the network in terms of the service sectors, who's at the table, to assess the relationships and the level of connection between those partners at the state level. You can see there are high levels of interagency trust among these agencies. And then they share kind of what activities they engage in that they feel make the biggest difference in accomplishing their goals. When we ask partners about the most important outcomes of the initiative or the potential outcomes of the initiative, that's when I look for shared vision, is what I call it. the level of agreement among partners as to what the purpose of the initiative is. And what they reported at the state level is that this program serves families and children in high-need communities, reduces health disparities, and increases implementation of evidence-based programs. So I thought that was fabulous that the message has gotten out there, that the program is recognizable for what it's intended to do. I also wanted to point out, I think this came up, Life shared this, we can ask partners how successful has the initiative been from their perspective so far. And in this case, for the first time we've sent a statewide survey, 63% said that MIECHV had made progress, a fair or a great amount of progress, and a third felt it was too soon. And I want to point this out because MIECHV is 5 years old in Florida, and compared to these programs that have been around for decades, they don't expect to see huge changes right away. So it takes some time. Our site level survey is the third time we're sending it out, and we have about 325 partners from 14 sites that are filling out the survey. So we're just about closing that up now. So again, just to give you an idea of what this tool can provide for you, this is from our baseline, our first MIECHV survey from the sites, and you can see the variation in the different types of networks and how they look. And then the state level, you can see that we have partners really from early intervention, Department of Children and Families, maternal child health, mental health, early learning, all those essential folks to address the benchmark areas that were the focus. Okay. The other things that we can look at with the survey is which partnership activities they engage in that they feel help the most. And then we always back this information up with focus groups, like you can see here. We use mixed methods to kind of add to a little more context and detail to these responses. And so, so you can see here in this quote is one administrator of our program explained about her community that the community is very collaborative, and most of them are focused on not necessarily on what's in it for them, but they're focused on the whole population. And the ones that are self-centered don't do very well in their community. So about, for those of you curious about partner survey and how it really, how useful it can be, the successes, the challenges, the feasibility, the burden, I can say that our sites love the tool. They ask for it. They love to see their results. We do have a pretty good response from community partners, and that's part of just learning how to follow up with them. Newer sites, we have to follow up a little bit more as they get more familiar with it. But community partners do participate in the survey, and our response rates are good. As I mentioned, you can triangulate with other methods, so it's very informative, and sites use it to plan how they want to further develop their community partnerships. The challenges, I would say, the biggest challenge is for the sites that we work with to identify their list of community partners, believe it or not. So their partners can range from 6 to 60 partners, depending on the community. And so they have to identify who's a partner that's engaged, and the partner doesn't need to be their closest partner. It's just anyone that they work with in their network. And then with dissemination, we send out reminders, we send out emails to explain about the survey. We have the lead agency send out an information email. So there's a little bit of follow-up. People call me and ask if they should be filling out this survey, and then I explain about it. Really, it's very user-friendly. Downloading the data and translating that into reports that people can use is very easy to do. And then if you're able to download the data and put it into SAS or SPSS and you want to do further analysis, you can do that too if you have that capacity. So here's an example of how we send out reports to each site. So they each have their own profile that kind of gives them feedback from mixed methods, including partner, how their network, for example, has grown from year to year. Okay, So I'm going to very quickly go through two other examples. The next one is the ECCS, Early Childhood Comprehensive Systems Impact Project, and these are neighborhood initiatives, very small communities, Liberty City, Miami, and Newtown, Jacksonville. And the idea is that the community members, partners in those neighborhoods are going to work together to elevate and to promote developmental well-being in children birth through age 3. So that involves a lot of interagency collaboration, focus, and there's a big data sharing component to it. We've implemented the partner survey the first year so that each community neighborhood network can see again who's at the table. And then also at the state level, there's a lot of state coordination. So our goal as evaluators is to understand these communities in all different ways, from the perspective of the citizens, the community members who live there, to the organizations. And so we do a pretty comprehensive community assessment, and then also we're curious about these teams that are working to increase their capacity for quality improvement and implementing community development. And so the partner is really helpful there. And again, we do focus groups and windshield tours and interviews so they can talk about how this connects to their partner results. All right, the last one, a couple of slides for the Infant Mental Health Project. And this one is really near and dear to my heart. I've worked with this group for the past 4 years. And this is in Hillsborough County. It's just one county, but we have about, I think, 40,000 children under age 5, so it's a big county. And this project was funded by our local Children's Services Council in partnership with our State Association for Infant Mental Health. And the idea is that our local Early Childhood Council would convene a steering committee of all the system leaders and agency leaders from these sectors: early childhood education, child welfare, home visiting, and mental health. And then we also have, you can see various levels of implementation. This is our initial team. So what's important about this slide is at the far left, you can see strategies. So the initiative was funded to conduct these activities: social marketing campaigns, training of level 1, 2, and 3 providers, so child care staff all the way up to licensed mental health therapists, convening of a steering committee to really work towards implementation and sustainability into the agencies throughout the county. And then magically this would result in improved infant mental health. And so we helped the initiative to fill in between using diffusion of innovation theory to really think about how these activities lead to all of our major organizations and providers in the community becoming more adept at promoting social emotional development and addressing infant mental health challenges in the community. Partner was really wonderful for us to be able to share with that steering committee of about 23 agencies how they have grown over the past 4 years in their ability to convene, to problem solve, to focus on sustainable change throughout the community. And so again, we've used Partner to show kind of what those networks look like, to get feedback on what activities they can participate in that they think make the biggest difference. And also, who were the most important partners in terms of the level of power and influence? So certainly the agency, the funder is there, and the implementation Early Childhood Council is there. But also, what all the partners felt was most important is that we had our early learning folks on board because they work with child care providers, and that we have ECCS, which was our local child welfare agency, involved because they work with a lot of children and families, and there's a big focus on trauma-informed mental health. And so, so that's really a nice feature of the tool. We also can see interagency trust growing over time, again, from Partner 1 to Partner 4 each year over these past 4 years. And we can see kind of the level of collaboration and coordination and then integration among the partners at this table, at the steering committee, grow over time. What we have done is, in addition to the partner survey, which we send out to this group once a year, we do focus groups, but we also did an observational checklist. We participate in their monthly meetings to kind of see how functional that group is. So this is, again, looking at their perceptions of the success of the initiative over time, the percent that felt the initiative was very successful or successful, and again, looking at the map to see which agencies are involved and if they have all the sectors that are important. And my last slide for you is just to share how theoretical frameworks fit well. The partners really, I think, aligned well with the collective impact framework, because you have kind of a backbone agency and you have a lot of processes, and really it can measure how community partners work together towards a common goal. We've also used community coalition action theory quite a bit, and that really describes, again, especially at the beginning of these projects, who's at the table, who's part of it, who are the members of the coalition, and then what are their processes that lead them towards community change and their outcomes. And then also, it's a very good tool to complement process evaluation or implementation science. So again, looking at the growth over time in these work groups, and it helps to generate discussion and reflection on how these groups are evolving over time as they work together. So we'll be using it again with 28 coalitions across Florida that are improving their intake and referral systems. And then we also hope to use the new tool to look at the participant family networks in the MIECHV program. So I know that was a lot, but here's my contact information, and I'll be here for a question and answer. And our MIECHV and ECCS evaluation website has a number of partner reports available if you want to look at those.
Well, thank you so much. Thank you, Jennifer. That was so good. And you know, I get overwhelmed sometimes with how much you have been able to accomplish in these years, and I can only imagine what is coming next. So it's really a pleasure to have you present for us. So thank you so much. What we're going to do now, it's my fault, we kind of ran to the end. So we do have this all scheduled for half an hour, and we know that our presenters can both spend 5 or 10 more minutes with us, but we're going to do the first set of Q&A for our presenters, for Blythe and Jennifer, and we have a couple of questions in there. If you have a question, go ahead and put it in the Q&A section. If it's about the partner tool, we're going to wait, and then our team can answer these questions for you. So we have a couple, and Blythe, the first one is for you, so I'm going to ask you to answer, how do you demonstrate your impact to your funders? And this person said they ask because they're challenged as a network with demonstrating unique contribution and value over and above each individual organization in the network.
Yeah, so it's a great question. We've worked very hard in helping our funders understand that they actually have funded a network and therefore will report to them on the value of that network. And that can only be done by asking people what they think the value is. So the partner tool actually does most of that level of sort of reporting to funders for us. We also, of course, because we use the collective impact model, we have to report on shared measurement, and because we're in early childhood, we also have to figure out ways that we're explaining how our existence is helping with program and practice improvements around early childhood using a shared measure. So those are sort of separate from the partner tool, but really we do report these things like the partner results to our funders.
Awesome. Okay. That's always a challenge, and I know that all of us are interested in that in many ways. We work for a lot of funders ourselves, and the reason that most of them are asking us to work is because they're interested in the return on investment, right, of what this work is all about. So we also have seen that as a question that we get a lot as well. There's one other question for you, Blythe, about how often you have administered the survey and so, or done this work, and I wonder if you could just talk a little bit about that.
Sure.
Yes, so sorry, Jennifer, you go ahead.
Okay. Yeah, for the Infant Mental Health Project, it's been annually. It's been one group and a very consistent group. And so they've been happy to complete that each year. For MIECHV, because the sites, you know, we've grown from 10 sites to 17 sites, and that's a more dynamic program, and they're implementing a lot, you know, to reduce kind of the burden. They fill out the partner survey every other year. So we're, we have the state level fill out the survey one year, and then the sites fill it out the next year. And so there's been time for them to do that over time. So they filled it out 3 times. And then lastly, for the ECCS, the Early Childhood Comprehensive Systems, those neighborhood initiatives, that's a 5-year grant. And they're really moving quickly to bring their partners to the table, to focus. So we will do that annually, again, to help them kind of reflect on where they're at and where they want to go next.
Excellent. And I think, Blythe, you have one coming up, right? Pretty soon.
Hopefully. I'm envious of Jennifer. I would love to be able to do it more consistently, but because we are an organic network, we're not sort of mandated to be in a system evaluating an existing system. We, like I said, we are using it actually to design the network more than evaluate the existing sort of pieces of the puzzle. So that's part of the beauty actually of the tool, is the next time we do it, which will be soon, we're actually changing some of our definitions of success because of the amount of growth and change that have happened. So they might not be completely baseline comparable in our case, but that actually wasn't necessarily the point. So it'll be just more information for strategic level decision making.
Great. So here's a question I think either of you could answer. Given limited time resources, are there findings, for example, knowing openness to discussion, that tend to really benefit from additional validation and triangulation like focus groups?
I've used MIECHV. I usually create a partner report for one site, and then I meet with the administrator at that site, and they have a chance to review their report and kind of talk about it. And so that interview provides context for us, but it also helps them to interpret it and use it and decide how to use it. I think it's really helpful to, and the focus groups as well, even when they're talking about who's at the table, the number of partners and the quality of relationships, and then how they build those partnerships. So we use it kind of more as a tool for reflection and discussion. It's and usually I think they naturally kind of give feedback on almost all the aspects of partner. So I wouldn't say there's like one partner question that we need to validate through another method.
And Blythe, did you want to add anything on that question?
I think it's all about setting expectations. So filling out the survey does take time, but framing that and making sure to feedback, you know, as Jennifer's doing through conversations and discussions on how the information is being used, what their contribution enabled as a result of filling it out is really important. So that process has actually just been really generative, and it is time to fill out. So there's no question about that. We also do developmental evaluation alongside all of this. So we do interviews and an ongoing developmental evaluation type work. So it's a huge investment, but actually our strategy in developing the network is to focus on learning. So without actually, you know, having people invest the time and then understanding the benefit of that, then it's and then I think it's a missed opportunity. So we just embedded that from the beginning, that it was an expectation of how we were going to do a good job. and that helped people sort of dive into it.
Great. Okay, so we're starting to get a couple of the questions about partners. So well, the first one, though, I think the three of us could answer. And then if folks on the call do have questions just related to the partner tool, feel free to go ahead and put those up in the Q&A box. Someone asked, could you speak more about how this tool takes a community-based participatory approach? And I know that I mentioned that, so I thought I would start with an answer to that and then see if you all wanted to add anything. And to be honest, the tool is just a tool, right? It doesn't actually take the approach. So the decision to take a CBPR approach is really the choice of the evaluator or the researcher, the person giving the survey out, and it's just the way in which you interact with the community around it. So for example, what my team does, not always, and we have to, because we take the CBPR approach, we actually let the community decide these things. But one of the things that we learned really early on was, especially when we were comparing, people are asking us to do analyses of networks and comparing them, we were really adverse to that because our understanding that networks are so context related. They are based in communities which are different. The culture in those communities are different. You know, how a network is led in one community can be very different than in another community, based on history, based on the ways in which leadership has played out in communities in those situations. So what we are very careful about is not ever saying what we know what the best network looks like. Rather, we work with communities to try to help understand what their goals are, what their hopes and dreams are for achieving when they work together on issues. And so we personally, I didn't show it today, use an approach where we go into a community often and we do this exercise that some of you will know if you've been at one of these, with a foam board and thumbtacks and rubber bands, and we actually ask people to construct a little network for us of their ideal network. And it's not a perfect science, but what it allows us to do is get a sense of where they hope the network is, and then we will then do the measurement, and that allows us to create a gap between where they are and where they want to be. And so we involve the community in that. We involve them in designing the survey. When we get the data, we always first go to them before writing a report and ask them what resonates, where we're interpreting things that are making sense to them and things like that. So that's how our team does that. And you know, we try to pay attention to issues of inclusion and equity and making sure that if there is a power imbalance that is rising out of this work, that we are cognizant of that and trying to address it. So that's what our team does to take a CBPR approach. I don't know if Jennifer or Blythe, I know both of you probably have to head off in a second, but if you have anything to add to that, please do.
This is Jennifer. Yeah, I'm happy to stick around. And kind of like you said, we allow the community kind of helps us to develop the survey questions, decide what the important sectors are to them, what the outcomes are that they want to ask their partners about. And one thing that I think was really telling is that all of these networks and some new ones have asked us, hey, can we please do that partner survey again? We really want to be able to see where we're at and kind of plan and use it. And so, so they're asking for it, and they're using it as a tool for planning how they're gonna create and strengthen their networks. So they do. The questions are very good, and they're kind of structured, but there is a lot of flexibility in how they want to use it and what the focus is, and being able to adapt the survey.
Great. Okay, so we're getting a couple of questions about the partner tool, so I'm going to kind of switch gears in that way. So this is where we're doing things like we've not done before. So before we switch to that, I do want to thank Blythe and Jennifer one more time for saying yes and doing this webinar with us and just being such great partners for us in our own learning. And so no reason for you two to get off, and we're going to keep you as speakers, so feel free to chime in. But we are going to go ahead and switch over. So thank you both, and we hope that we're going to see you soon.
Thank you, and happy to answer any questions offline for anyone who wants to chat more. So thanks for the opportunity.
Great, good, and we haven't talked to everyone, but we know Blythe is going to be at our NLTA this year. So if you need more of Blythe Butler, be sure that you attend that this year, because we always do. So okay, so we're going to answer a couple of questions, and first I just wanted to kind of, my team won't let me put the video on, but what you'll find, so we're just going to be by voice here, but what you're going to find from now and always if you work with us is that we're a very fun team and pretty informal, and so we like your questions, we like discussion, but today with us is Melinda Mochizuki, who most of you will have seen her name, and she's our events coordinator and training director, and Kaylee Newman is with us, who does analysis and manages our database. You guys can say hi. Hi. And then Becky Hofkees, who does tons of our evaluation. She is in the weeds on our data all of the time, is here also. And then Stephanie Boltema is with us, who's one of our PhD students and has, I think I'm saying this every time now, really upped our game at the center by bringing the GIS and ARC Gephi work into our work and really helping us think about how to kind of use our own data in different ways. Sarah Sprung, I believe, is not on the phone, and if she's not, and if Sarah, if you are, just ping one of us. We're hoping that she's not, because that will mean that she's hopefully out having a baby. Okay, so we're going to go ahead and answer some of these questions, and I'm going to let our team do some of that work as well. So one of the first questions is about Partner 2.0, and also we've noticed there's some questions that have been going on in the chat box, and so if you have questions you want to, especially if it's around your own project, go ahead and put them in there, and our team is just all in the chat box and all answering them right now. So one of the questions is, will Partner 2.0, which I mentioned, replace Partner 1.0? And will any of the data that someone might collect transfer into it? So that's a good question, and the last thing we want to do is alarm anyone. Actually, we have a vision as a group of where we'd like to go next and how we'd like to kind of build something that we believe is even more aligned with what we see people needing in the future. And so it's not all designed yet, but yes, the answer is yes, that with all good outcomes, what will happen is that you will always be able to take what you have and put it into the new tool. In fact, we're hoping everyone does, which will feed the new tool with a lot of data that will let us immediately leverage our collective work in putting out these partner surveys to build state profiles that are as comprehensive and you know, on the verge of updating in real time as possible. So if you're interested in using Partner, don't wait for us, is what I'm going to say now, but we will always communicate with folks about that stuff. So I'm going to have to read some of the questions like in real time, and Kaylee, you had a few that came in the chat box, and I wondered if there were any that you would want to bring up. So take a look at that and just decide. And so this next question says, would Partner be effective within an intra-organizational context, such as an organizational network analysis? How flexible and adaptable are the questions? So I'm just going to be really transparent here and say the person who just asked this question should answer this question. And if you are willing to answer it, you let me know and I will identify you right now. So I won't say who you are because we won't do that. But the answer is yes. You can use this inside your organization just as you would outside your organization. There's really nothing that prohibits that from happening. it's only the context in which most people are already using partner is inter-organizationally, so across organizations. And so and then the follow-up question here was how flexible and adaptable are the questions? So I think I'm actually going to let someone else from our team do this, or I'll be talking the whole time. So Kaylee's going to talk about how you would adapt the questions for any context.
Yeah, so there's actually a really helpful resource on our website, which is our default survey questions. And it has a column that kind of explains the flexibility of each question and response individually. The survey is actually very flexible. In general, the context of the question needs to stay about the same. So for example, if it's a multiple choice question, it needs to remain a multiple choice question along those lines. Another thing is the relational questions are really flexible. You can edit those quite a bit depending on what your research questions for your specific network are. However, the trust and value questions, they need to be, you can make them more specific to your context of your network, but the nature of those questions needs to remain the same, meaning that they need to measure value and trust, because that's kind of what we do here at Partner, and that's really what makes the tool special. So those are the only questions that you cannot modify fully.
And the only other thing I wanted to add to that was some people ask us in a kind of similar way if it has to be about organizations, or can the survey be about people? And literally you can make it about organizations or people. Again, there's nothing about the tool that defines that. The 18-question survey, default survey that Kaylee just mentioned, is designed primarily for inter-organizational community networks. So it's harder to adapt the survey outside of that context, but our own group here has used it, for example, in classrooms. So, looking at student networks who versus those in person versus those online. So we just adapted all the questions to have something to do with those kinds of connections. But it has to be 18 questions. You can't delete any of the questions. And what I always say is the spirit of the question needs to stay the same, meaning that if it's a multiple choice question, it probably needs to stay a multiple choice question, and so forth. But that's also what makes it so easy to use, because then it transfers really well. So let's see. Another question that we got was, given that the survey asked questions about relationships between members in a network, have you ever experienced negative reactions from network members when presenting the results of an analysis? And do you have any advice for evaluators about how to do that? That's a great question. And it's inevitable that we deal with this. And it's what we've never dealt with, what we have literally never had an issue with, is that actually was the results. That we actually had people see the results and feel like they had negative things said about them. So, and I'm just talking about the evaluations that my team has done. So some of you who are managers on the phone might have had that, but there is always the concern from someone in the survey, or there could be, that's going to happen. And so for those of you who aren't familiar with the survey, the kind of the trademark partner questions are these series of questions on value and trust. The reason I say it that way is those are questions that, are not like, they're not as standard as the others. They're skills that we validated and created through our own work, and kind of called partners questions. And those questions ask people to answer questions about each other on a scale of value, which is a scale of power and influence, resource contribution, and time commitment. And then another set of questions asks them to rate trust. And we never use the word trust, but we ask them to rate each other on reliability, mission congruence, and openness to discussion. And people get very concerned sometimes about answering those questions about one another. So what we do to help people move forward is we assure them, for one, that none of their individual answers will ever be actually seen by their partners. The way that it's presented out through the tool is aggregated. So the only thing anyone ever sees is actually an aggregated score, like a mean score of what other people said about them. The person running the tool, the evaluator, let's say, we call them the manager, has all the data, the very, very nuanced data of who said what about whom. So it's important with how you treat that, and that if you ensure people that it's confidential and anonymous, that you respect that. But you can always assure people that they won't actually see each other's answers. What could happen is you could get a person in the network that notices that their average trust or value score is less than a 3, which to us is a kind of the baseline measure of a good score. And what we do with that is we also say, look at this great information we have, think of all the action steps that we can create in order to try to either elevate value, perceptions of value, build trust. And the last thing I'll say about that is, one thing to keep in mind is that in all of this work, more is not better. So keep that as a message to these people. More connections is not better. Literally, more value and trust may not be the goal. If you look at those people in the network and you realize you are leveraging everything that you already need from them, I wouldn't change anything. So we do not interpret our scores as though more trust is always going to be better. We look at it in the context, is it enough? Are we getting what we need from the network? And then try to move on from there. So thanks, that's a complicated one. And so thanks for asking it. So let's do another one. So here's one. I work with rural communities and keep coming up with the issue of people wearing multiple hats outside of the network we're facilitating. Is there a way to have them identify multiple network connections to evaluate how the trust and communication from those connections impact? So a few of us have worked in rural communities. I'm going to check with my team and see if anyone prefers to answer that. Let me give it a go while we're thinking. So this is a great question, and one thing that we have noticed in networks across communities is that if people are asked to sit on multiple networks with multiple capacities a lot, but in rural communities that happens all of the time. There are some ways to use the survey and kind of customize the survey, so you can ask people to take on a certain role when they answer that question, or to put their question in a certain context. So there's enough flexibility in the survey that you could adjust the question to account for that. This is such a good question too, and it's something that we can keep talking about. Was someone on the phone going to answer?
I can jump in. This is Jennifer Marshall. So for Hillsborough County, we have an infant mental health initiative, and we also have a MIECHV program. So naturally, there's a few partners that are in both networks. So they have filled out the survey, 2 different partner surveys. And so it is possible to, and you know, it's just how you present the survey, explain the survey, and I follow up with them and say, this is for the Infant Mental Health Project, and they answer as such. And then they would fill out the survey. It doesn't take very long, so they fill it out for the other ones. So it would be possible, especially if that happens a lot, because it definitely does, and in some of our other, even our rural communities, or in communities like here where there are a lot of interagency initiatives, we could look at the scores for those partners and see the characteristics of those individual agencies and see if there's something different about them. That's the nice thing about being able to download the data and use it however you like, you know. So I think you could.
Great. Thank you. And I'm so glad, Jennifer, that you were able to come in and answer that question. So thanks a lot. So we just had a question, and so I'm kind of messing with my computer right now, that someone said, you mentioned the tool for the future that can be used for personal network data collection. Will it include an easy way to measure alter-alter ties and format the data? I'm going to take this opportunity, since someone just asked, and show you all just a little bit more about that tool. I'm assuming that, I'm pulling up some slides. I'm assuming that in the future we will we'll have a webinar on this. So let me pull this up. Okay, so I'm going to ask my team out loud here if you're going to be able to see my screen here in a minute. Okay, great. Okay, so since this came up, I'm going to bring it to surface for a minute. So the tool that I mentioned is the Person-Centered Network app, and there's a whole great story about how this app came to be, and it has a lot, and we'll show that, but to you in another webinar. But what is really important to know about this is that we didn't mean to create this tool. We responded to a need that we identified by taking a CBPR approach, by working with communities and listening to them. So long story short, in a study where we were measuring networks using the partner tool and systems and interorganizational connections, we realized that the people inside of those networks didn't necessarily feel like that was the best outcome. So we were measuring a high-functioning system as a bunch of organizations working together, when really what we started to learn in a project working with families with children with special health care needs, that their own personal support networks were really the indicator of whether the system was working. So that's a whole nother story, but from that, we used to present on it a lot, and finally got invited to be a part of the Innovators Society, which was the Community First Foundation in Colorado's like a competition to present and compete for funding around innovations in mental health. And I participated in a 9-month program and ended up doing a 5-minute fast pitch competition, and we won $65,000 in that to create this person-centered network app. So what we mentioned before was it, and what you'll see here is Visible Network Labs, which is actually our new enterprise, which is the home of all of our software and where we're going to develop everything in the future. So that's where the app will live and come out of. So just to give you a little bit of context, you'll see here that this is from a different presentation, so I'm kind of winging it here, but it assesses personal support networks, and it can literally assess the strengths and gaps in personal support networks. In the context we're building it in right now, it allows providers to use the information to make personal assessments of a need and then connect them to resources in real time. The pictures you'll see here are real. It literally has a screen like this. So the question was, can it measure alter-to-alter ties? And yes. So what you see here is that there is a set of questions. It's even more adaptable than the partner tool, meaning that you can completely change all of the questions. You can add in your screener. You can ask only the network questions or add others. We learned from partner, and this is very flexible. And so with your finger, you actually draw the network map. And so here you can look at the person's ties, and then for those who don't know, an alter-to-alter tie is all of the people surrounding you in this picture and their ties to one another. So let me just go through a couple of more here so you all can see. Oh, well, this is just to help folks know where you can use it. So this is meant to be used by anyone we think who's in a helping capacity, who wants to kind of learn about other people's networks. But we also have researchers who are using it, meaning they are just using it to collect network data. So the other part of the person's question was, is the data formatted? And one thing that I can assure you is our team is absolutely amazing at data structure. And so just like with the partner tool, one of the reasons you might choose to use it over another tool is because literally what you export is just cleaned and ready for any kind of other tool. We've spent a lot of time figuring out, I'm looking at Becky right now because we've done a lot of work on the data structure and restructuring things so that we can account for that. So the data structure that's exported after each person's assessment is actually extremely clean. So if you're, and what I mean by that, it's in the fewest number of spreadsheets in an Excel sheet, and it comes out, so for example, the dyadic data will show, like, of all the possible dyadic combinations, which ones they indicated had responses, so you can see those that did and those that didn't and everything about them. I don't have a slide of that, so. And thanks so much to our beta testers who dealt with us not having that ready and helped us figure it out in case any of them are on the phone. So just a couple of things on this really quick so people know. It literally, so like questions are being asked, and people can literally draw with their finger, these kinds of things. The questions in our default survey ask people what are their most pressing needs. It lists a bunch of items related to social determinants of health. Then we ask people who know who of those people who help them know one another. This question right here just said, which of them coordinate care for you? We asked, to what degree do you depend on each of these people? To what degree do you trust them? And the red lines there show low trust or high dependency. And then here you'll see we have a partnership with Aunt Bertha, which some of you may be familiar with. On this screen, you'll see people could have asked which social determinant of health they are most in need of. On this last network screen, you'll see the people, the need that they identified that they are most, their most pressing concerns. And then this question here asks, who helps you with them? We learned by working with a lot of families that people prefer to help themselves first. So instead of just finding what people need and sending them to resources out in the community, we first take this step to say, you know, where can we empower you? Where are your resources? How do we help you think about those as strengths before we find the gaps? And then one of our goals in that is to make sure that we are helping people really identify their most pressing needs. We're not overwhelming systems, both people and the community resources, and we're finding some way to really try to understand people's ways in which they can help themselves, and then where they might need help. And when they need help, we have referrals that we use Aunt Bertha because it's the only database that can search for referrals by every zip code in the country, and they are just amazing partners for us. And so our app connects right to them, but eventually it can include any referral resource database. So people can use this for the purpose in which we are launching it. They can also just use it for data collection. So yeah, there's a lot there. This is a little example of how we're using it for kids. You can imagine, instead of asking them about social determinants of health, we ask them about things that they're dealing with, and then in the same way, link them to these resources right there in their tablet. And this is my daughter, who loves using this, presenting with me at one point. So anyways, we'll do a whole webinar on this, and for those who are interested, we are going to, in a few weeks, put a call out for people who want to pilot test it. And just for those who want to start thinking about that, we're going to ask that people use it in a helping capacity setting, that they are willing to screen at least 50 people and contribute to a pretty rigorous feedback process with us, where we're learning from you and how it's used, and from everything, how the survey works to how the referrals work. And then we will use that in real time to make all of the updates and then release it as for folks to use more like as a subscription. So anyways, thanks for that opportunity. Obviously, we're excited about that as well. Do you want to add anything, Becky, while you're here?
I think that was great.
Becky is very humble. She's been working really, really hard on making all of this happen, and she's excellent actually at working with people in the community to answer questions or help them think about this. Let me just see if there's any more questions. So I don't see any other questions. Do you guys? Okay. So I'm going to open it for just a second, because we still do have some folks on there. If anyone has a last minute question, please plug it in real quick, so we can answer. I'm always, oh, there is one. I'm always amazed though at people who hang on with us. We are a really personable group, and we love connecting. This is our favorite part. So if you want to connect with us after this webinar, please do in any way. Okay, so here's this, we'll do this as the last question. Do you have a complete report of findings that you can share? The language in the technical manual is helpful, but wondering if there's a complete example of how to report data back to practitioners. Yeah, that's a great question. I mean, we have lots of examples. This is what we do. So one of the reasons that we don't actually have those all over the website is because a lot, like you probably, a lot of the work that we do is identifiable. And so you'll even see when I gave our examples showing the geographic maps and things like that, it was I kind of scrubbed the names on there. So the one reason I'm hesitating, because we actually have, yes, very complete reports that are scrubbed, but in the last year, my team has completed quite a few evaluations that have just even changed our capacity, and what we've been able to do with our clients has been pretty awesome. And I think that we can create something for you that is even better than what we have right now. So I think this is a good question that we are going to put on our list of how do we give you all a good example of that has is pretty thorough. I do think there is, gosh, maybe it's just not posted, because we do have one that is already scrubbed of identification. One. Yeah, and actually there's one you could see right now. We just finished, it is public. Becky just whispered it to me, although she could probably say it. We just finished a project for Denver Dayworks, which is a City of Denver project. It's public, and luckily it was commissioned by the city, so everything they do is public. This is kind of silly, but the quickest way I know to find it is that the Denver Post did an article on the Denver Dayworks and put our evaluation report right in the article. So if you Google the Denver Post and Denver Dayworks, you'll find the evaluation report. The only thing about that, it's a pretty comprehensive report where we used qualitative interviews, secondary data, as well as a network survey. So it's not very comprehensive in terms of all the data you could get out of partner. It's kind of selective because we just had to make the report end at some point. So so if you find that, you'll see some examples. And then we might even be asked, we'll ask some of our, we've done the evaluation for the Kids Count Network, and they have a public facing version. And we have finished a few others that I think we'll be able to share. So that's something that we'll announce on our next webinar. We'll figure this out. Thank you for the question. Okay, I see one quick little thing on the chat. Let's see. If I wish that I could have a little bit more opportunity to show off how good my team is at answering these questions instead of just me answering. So if we do this again, I think it's going to be without me, is what I just decided. So we're going to go ahead and end it now. There's a couple of comments about our team and things like that. So thank you very much for those comments. We appreciate them, and you guys make it worth our while. We really love this kind of interaction. So thank you everyone who stayed on. If you like this, tell us, because we've talked about doing these kinds of like more open Q&As and things like this. So we know we get tons of emails. So we're wondering if we can actually be more efficient by answering people's questions in groups. And if you are at all hesitant, please let us know if you have questions about coming to the NLTA or using the partner tool. We'd like to help you figure out if those kinds of things are right for you. Anything else? No? Okay. All right. Well, thank you to everyone, and we'll hope to see you on our call in February. Thanks so much.